Our final presenter for this first session of day 2 of our workshop is Dakota Gruner. Dakota is the Executive Director of ID 2020, a global public-private partnership which brings together technologists, advocates, implementers, and funders toward a common vision, a good digital ID for all. In February 2021, ID 2020 launched the Good Health Path Collaborative, a cross-sector global initiative which has brought together more than 125 global companies and organizations from across the technology, health, and travel and tourism sectors to develop principles and standards for digital health passes aimed at restoring international travel. Dakota launched ID 2020 in 2016 following her work at Gavi, the Vaccine Alliance, where she served as aide-de-camp to the CEO, Seth Berkley. As a graduate of Brown University with dual degrees in biology and political science, Dakota started her career as a management consultant with Oliver Wyman. She was recognized by Forbes magazine as part of the Forbes 30 Under 30 in 2019. Dakota, I'll pass it over to you.
Abby, thank you so much, and thanks to everyone here today. Let me quickly pull up my slides. Let's see, is that visible? Great. So, I wanted to sort of take a step back from the conversation, that I think both Josh and, and Abby and others have framed, and sort of discuss the idea of health passes in the context of international travel. What we've seen is in recent months, dozens of health pass solutions that have rushed to market. And we've seen, just in recent weeks, increasing efforts in order to encourage the use of vaccine passports or health passes, as we prefer to call them, not only for international travel, but for a whole host of domestic use cases as well. And so, this could not be a more, sort of urgent conversation to be had. What we know is that there, of the host of different health pass solutions in the market, they vary greatly in terms of privacy, security, and user control over one's personal data. And in the absence of standards, none are interoperable. And I think interoperability gets discussed regularly as a somewhat abstract concept, but the implications of interoperability are profoundly felt. When all of us use our passport or use a credit card, we have every expectation that passport or our credit card is going to be universally recognized and trusted. We take it out of our wallet, and the expectation is one of universal trust and recognition. What we see in the health pass space at the moment is something very, very different. I don't know how many of you have traveled this summer or plan to travel this summer. My slides are a little bit out of order, but for those who've traveled this summer, I think what you've experienced is very long wait times. Airlines are reporting, multi-hour delays for travelers when they arrive, for border authorities, significant delays as someone is trying to board the plane. And this really does come down to the fact that we have multiple different forms of health passes being issued in different countries. And we are asking airlines and border authorities to manage a lot of complexity around different health pass solutions. And with that, technical interoperability is necessary, but it's insufficient. Without governance and trust registries, a credential cannot be recognized and trusted. And so really, what I want to spend some time today focusing on is this question of sort of what constitutes interoperability and how do we, in the sort of grandest sense of the collective we, begin to get to the point where we do have that universal recognition and trust. So, I'll run through each of these very quickly now. We'll touch upon each of them again as we kind of, move through the presentation. But I think there are really 9 different elements that we've identified that are critical for interoperability that is as flawless and as seamless as the interoperability we're used to with a credit card or a passport. And we bucket these into 3 general categories. The first is really around usability, and many of the things that Josh has touched upon in terms of security, privacy, and data protection. So how do we know that people can have, or how do we ensure that people have a consistent user experience, that they can have the assurances they need that their data will remain secure, that they have the ability to control it, and to make choices about how and where it is used, and that standards around identity binding. How do you know that the person presenting a credential or being issued a credential is the person who should be presenting or issued that credential? All of those need to be solved, and many of those are, they come down to sort of to social systems, they come down to workflows and processes. Then there's a category around credential interoperability. And here I think is where some of the really, really great technical work has occurred. And I think where as a community, we're starting to see real alignment. Standard data models and elements. What information about someone's vaccination event needs to be captured? Or testing for that matter, and how. And this is where sort of credential format, signatures, and exchange protocols comes in. We have also done sort of extensive work, as I know, VCI and others have done, around paper-based credentials. It's vitally important that we see health passes being inclusive and accessible. And with that, it's critical that individuals have flexibility to present either a health pass on their phone or something that is carried as a paper-based credential in their wallet. And with that, how do we ensure that all of the same protections for privacy and user management are built into the design of a paper-based credential? Finally, there are really important questions around the operational infrastructure. So how do we actually sustain a healthy digital trust ecosystem where somebody can present a credential and you can know that it is one that should be recognized and trusted? And I'd argue this is the place where we're seeing really insufficient global collaboration at this point. I think for those who have traveled, I think many can describe there, can relay this themselves. Incredibly long queues, absolute chaos as people are trying to cross international borders, because what we've seen is the sort of the development of either state or national level trust frameworks in the EU, the launch of the European Digital COVID Certificate, and with it an EU level trust framework, but without an international trust framework and really sort of an issuer registry that works at an international level. How is a border authority meant to know that the credential that you are presenting is one that is in fact legitimate? And that's hard enough if you're a border authority, harder still if it's an airline individual who's sort of been deputized to run these checks for passengers pre-boarding. So the Good Health Pass Collaborative is a multi-sector global initiative that was designed really to sort of unpack these challenges around interoperability and to establish a set of principles, standards, and a governance framework for digital health passes for international travel. We bring together a large and frankly somewhat unlikely group of partners. This is, I know that most people sort of tend to glaze over when you see a slide with a huge number of logos, but to call out just a few things in this, which I think are important. The first is that we have over 120 organizations who've been involved in the Good Health Pass Collaborative. And with that, we have all of the major health pass solution providers. So when you think about how we get to the point of a critical mass of health passes adhering to a set of recommendations, standards, and specifications that would promote interoperability, the fact that all have been involved in the development of the Good Health Pass interoperability blueprint is an encouraging sign. The second is that there's sort of broad representation from organizations across both the travel and tourism sectors and the healthcare industry, as well as those who've been working in the technology or identity sectors. And so with that, really the intent was to say, how do we leverage sort of the experience of organizations who are feeling the pressures and the pain points around verification of health passes, and really ensure that the solutions that are being adopted and being developed are ones that reduce this complexity, make it easy for individuals to travel and to do so with full confidence that their data is secure, it's their own to manage. I think sort of hot off the presses, we have published the Good Health Pass interoperability blueprint, and it articulates recommendations on how to design an interoperable digital pass and trust ecosystem. These are recommendations along all 9 of the interoperability challenges that I sort of enumerated earlier, including sort of specific guidance on credential format, signatures, and exchange protocols, sort of key requirements around selective disclosure, which I know Josh touched upon earlier, as well as a set of recommendations around the establishment of a trust framework, trust registries, et cetera. To quickly run through just a few of the design considerations, this is taking a 189-page document, I believe, and compressing it down into 5 bullet points. So, I certainly am not beginning to cover off everything. But the first, and I think this is something that we heard from Josh as well, we believe it's absolutely vital that the individuals at the center of the data exchange, just as we see right now when somebody has a paper-based credential and they have the choice to take that out of their wallet or not, and can do so with confidence that there has been no sort of ping back to the issuer, to their healthcare provider to do so. We think it's vitally important that digital health passes give individuals those same levels of trust. And I know this is something a belief that we share with many. So we recommend a decentralized identity architecture that incorporates the W3C verifiable credential standard. And we do focus on this idea of selective disclosure. Equity and inclusion are absolutely essential. I think one of the things that and I'm sure everyone here is very sensitive to is that with inequities in vaccine distribution, it's going to be many years, unfortunately, before the world is vaccinated. And with that, we wanted to include minimum data sets, not just for vaccination, but also for testing. That it would be exclusionary in a true sense if we only provided for proof of vaccination. And if we want to ensure that our response to reopening is one that is as inclusive as possible. One of the largest sort of terms in order to do that is ensuring that you can either provide proof of testing or proof of vaccination, or in fact, proof of recovery. The other, sort of, I think, critical component around equity and inclusion is the work that we've done on paper-based credentials and passes. Like I mentioned before, we think that everyone should have the optionality to either present a paper-based credential or a digital one, and that for those who don't have access to a device or don't have routine access to connectivity, that those paper-based credentials should not be second rate. That they need to afford the same protections for privacy that we would expect of a digital health pass. We also focus on decentralization as necessary for global security and scalability. And I'd argue this is also important when we think about how we take the sort of patchwork quilt of different trust frameworks, different health passes that we see out there at the moment, and begin to knit them together into something that is truly interoperable. So with that, suggesting a global ecosystem of decentralized trust registries using the W3C decentralized identifier standard. Finally, two, I think, more important ones. Use of open standards is necessary for interoperability and participation. This needs to be a model that really does allow countries and non-government issuers to very quickly sort of on ramp and to participate. And finally, ensuring that this is grounded in reality. I think all of us are eager for an approach to health passes that works very quickly and facilitates a much more sort of seamless sort of experience, whether it's for international travel or for domestic use cases. And with that, we've provided phased recommendations on sort of a 30, 90, and 180-day schedule to support incremental improvements and recommendations for ingesting existing or legacy approaches. This was certainly not designed to be sort of perfection being the enemy of the good, or making it impossible for organizations to make those incremental improvements towards interoperability. Very quickly, I did just want to touch upon this idea of purpose-specific selective disclosure, and I think an important point around the sort of difference as we see it between certificates or credentials and passes. Josh, I think touched upon some of this, but we actually think that this is important not just for the purposes of protecting an individual's data and ensuring that only the minimum data necessary in any sort of given interaction is what's shared, but also as a means to say, how do we begin to knit together, sort of the plethora of different health certificates or credentials that are being issued and make it very easy at the point of verification. So with that, the way that we've defined these terms, a health certificate or a health credential is one that contains the full set of health data necessary to prove health status to any verifier. We see these as something that, sort of signed clinical data useful within a healthcare ecosystem. Lots and lots of really important information here, and particularly as we imagine the sort of potential extrapolation of this work to other forms of verifiable credentials for the purposes of healthcare. We see huge utility in the idea of somebody taking a verifiable credential of their health data that's signed and able to be shared quite easily and flexibly with others in the healthcare ecosystem. But this is sort of not context specific, right? It wouldn't contain anything around perhaps someone's visa for travel, any additional data. And so with that, we sort of think around this filter of a purpose-specific selective disclosure. How do we ensure that in any transaction, an individual sharing only the minimum data necessary to convey health status to that one particular verifier? And with that, you might need to generate a health pass or travel pass as sort of a secondary pass that does contain either additional specific data or removes any of that extraneous data. And that process of sort of generating that secondary pass or secondary pass is also, I think, an important piece of how we begin to see all these things knitted together. At the moment, if we've got a sort of wide universe of different certificates and credentials, we're seeing it certainly from those in the travel space, many of the airline alliances, IATA, others, ACI, really saying that we need to sort of minimize that complexity, and we do want to see people coming with a health pass and something we can verify. So with that, thank you. Happy to answer any questions. And it's great to be here with so many friends and collaborators.